Dr. Ken Landau. Thanks for watching. Let's talk about Viberzi. Viberzi is a drug used to treat the diarrhea form of Irritable Bowel Syndrome, or IBS. It was originally approved on May 27, 2015, and it works the same way that the opioids do when they cause opioid-induced constipation. So if you take the hydrocodone or the oxycodone or any of the other opioids, you're going to get constipated. And when you get constipated, it works because inside the gut, it's activating the opioid receptor known as mu. That's exactly the same way that Viberzi works. Well, additionally, Viberzi seems to relieve abdominal pain. It relieves abdominal distension. And by stimulating this mu receptor, it's going to decrease the muscular activity of the gut, so it's not going to propel things out of you. It's going to tighten your rectal sphincter tone so you can withstand going at a moment's notice. It's going to inhibit the amount of water and inhibit the amount of electrolytes that are secreted into the gut. And it also seems to activate something known as the delta receptor. And the delta receptor seems to prevent getting too much constipation. Well, because Viberzi works on the opioid receptors inside the gut, it's considered a scheduled drug, a classified drug. Classified as a Schedule 4 drug. Now, hydrocodone and oxycodone, Schedule 2 drugs, lots of restrictions on them. But this drug has a low potential for abuse, low potential for dependency. But if you happen to have maybe engaged in a little bit of nonsense with the hydrocodone and the oxycodone previously, you have a 15 to a 30% chance of liking or having a euphoric reaction to somewhat higher doses of Viberzi than we typically use. And some people have used this drug intranasally or just orally. Now, how do you take the drug? You take 100 milligrams twice a day with food, but if you have certain conditions, like you drink too much or you're an alcoholic, more than 3 drinks a day, you better cut down to 75 milligrams twice a day. If you have mild to moderate liver disease, same thing, cut down. If you've had your gallbladder removed previously, cut down to the lower dose. Now, what do we know about IBS, or Irritable Bowel Syndrome? It's estimated that it affects somewhere around 15% of the general population in the country. That means about 45 million people have the condition. Women outnumber men by about 2 to 1. The majority of people with IBS have not been diagnosed, but if we look at people who go to see their primary care physicians, general practitioners, or internists, probably somewhere around 1 in 8 suffers from the IBS. If you look at people in gastroenterologist's office, well, it's going to be somewhere around 1 in 4 with IBS. IBS, or Irritable Bowel Syndrome, can be divided into several types depending on what the stool pattern is. So we have a form associated with diarrhea, another form associated with constipation, a form associated with both diarrhea and constipation that are mixed, and an unclassified form. It's estimated that probably about half of the people with IBS have the diarrhea form. That means about 5% of the people in the general population. And frequently, when you have IBS, it's associated with anxiety or depression or maybe even post-traumatic stress disorder. Some of the other symptoms of IBS, it may include abdominal pain and bloating and distension and diarrhea and gas and the very sudden need to use the restroom. Well, Viberzi is only for adults. It's not been studied in children. It works locally inside the gastrointestinal tract on those receptors we talked about a moment ago. It's not absorbed into the bloodstream. Fewer than about 1% of the total medication is absorbed. You shouldn't take the drug because it's used for people with diarrhea. So if you're already constipated, you don't take the drug. Or if you have a gastrointestinal obstruction, you don't take the drug. You have to be careful if you've had your gallbladder out or if you have a spasm of the tube that connects the gallbladder or the pancreas to the small intestine. If you had a history of pancreatitis, drug probably isn't for you. And certainly if you have severe liver disease, this isn't the one to take. Side effects of the drug, well, it causes constipation. So some people develop constipation. Now, if you're going to develop severe constipation, about 1% of the people taking the drug do, usually occurs within the first several weeks or certainly within the first several months of taking the drug. Other kind of side effects are nausea or vomiting or abdominal pain or sometimes a spasm of that tube that connects the gallbladder to the intestine. May cause pancreatitis. it's estimated that some people, very small percentage, can develop a high from taking the drug, a euphoria. They develop a drunkenness or sedation, somnolence, sleepiness. Some people develop gastrointestinal reflux disease. It's not been studied in pregnant women, but it probably is safe because it's not significantly absorbed. It does not seem to cause any problem with fertility. It certainly doesn't seem to cause cancer. It should not be administered with drugs that cause constipation. So, for instance, if you're taking a systemic opioid, if you're taking hydrocodone or oxycodone, you don't need this drug because those drugs do exactly the same thing. Another drug used to treat IBS with diarrhea, Lotronex, you don't take it with the Viberzi. And you have to be a little careful if you have some urinary problem and you're taking one of those drugs that acts as an anticholinergic to prevent excess urination, especially if you're a woman. If you develop diarrhea while you're on the drug, let's say you've been well controlled and you develop some diarrhea, the one thing you can take is Imodium occasionally and as needed. Now, it doesn't really have any significant drug interactions, but you do have to be a little careful with Crestor or with Paxil. Well, if you look at the people who are taking the drug, about 1 in 8 discontinue the drug prematurely because of side effects, mostly abdominal pain or severe constipation. Now, there's a television commercial advertising this drug. I find it very obnoxious. It features a woman who's known as Irritable. And Irritable is a lady who's dressed in a jumpsuit with a diagram of an intestine on it. She's the alter ego of a lady, drags her around, and this lady has the IBS with diarrhea. Well, you've probably seen it. What do we know about the FDA requirements for these kind of drugs? Well, in order for the drug to be approved, it has to show at least a 30% decrease in the amount of average abdominal pain that you suffer, and you have to be able to regain a relatively normal consistency of your stool for at least half of the days that you're on the trial. Well, basically, there were 2 studies of this drug. The average age of the individuals between 40 and 50, 2/3 of them were women. The overwhelming majority were Caucasian. All of the people suffered from irritable bowel syndrome with diarrhea. In other words, they had loose or mushy or watery stools more than 25% of the time, and hard or lumpy stools less than 25% of the time. And the worst abdominal pain they had in the last 24 hours was at least a 3 on a scale of 0 to 10. And the average stool consistency, as I say, was mushy or watery, or at least 5.5 on the Bristol stool scale. So the question is, how well does the drug work? Well, they looked at the drug after 12 weeks and after 26 weeks, and they found that it was the same. And the same means that about 70 or 75% of the people who took the drug did not get better. Let me repeat that. Of the people who took Viberzi, the people who reached the primary goal was only about 25%. 17% taking nothing, taking a placebo, not a change in their diet, not any other kind of drug, no other kind of therapy. 16, 17% of those people got better compared to about 25% of the people taking the active drug. And that's both after 12 and 26 weeks. And if you look at the abdominal pain improvement at 12 weeks, more than 30% improvement in the abdominal pain, well, it was 43% with the drug, but it was about 40 to 45% on the placebo. So it doesn't seem to work well there. And if you look at the Bristol stool scale at 12 weeks, well, it seemed that about 1/3 of the people improved and 2/3 of the people didn't improve. So we're talking about a drug that turns out to be very expensive, that doesn't seem to work very well, and it's never been compared or contrasted to either a dietary change or a different kind of a drug. Well, there's also been some improvement with the drug. There's little improvement as far as stool consistency and frequency and bloating and the global symptom score. But the VA Pharmacy Benefits Management Services in July of 2016 looked at this drug, and what they found was there's an itty-bitty, teeny-weeny, statistically significant difference between it and a placebo. Negligible clinical benefits. You need somewhere between 9 and 14 patients to get one person to improve. The medical letter, a very respected source of information for physicians that doesn't take any money from drug companies, what they found is that the drug's not much more effective than taking a placebo. Now, interestingly, we know that this drug is manufactured by Allergan Pharmaceuticals. Allergan Pharmaceuticals is a gigantic corporation. They have a lot of heft, so they can put a lot of money into marketing the drug, and then it'll probably be successful. And that's compared to Xifaxan, which was, interestingly enough, already on the market. When Viberzi was approved, it was on the market for hepatic encephalopathy and traveler's diarrhea, but it also got approval on May 27, 2015, the same day that Viberzi was approved. Xifaxan got the authorization to be sold for the diarrhea form of irritable bowel syndrome. Who's going to be the winner? Well, it's going to be determined by how much money is spent on direct-to-consumer advertising, how much the companies spend on newspapers and radio and magazines, what the pricing of the drugs is going to be, and what kind of contracts they're going to be able to get with the payers. Now, Xifaxan probably is going to be a loser. The reason it's going to be a loser is that it's made by Valeant Pharmaceuticals, and Valeant Pharmaceuticals has been hauled in front of investigating committees in the Congress because of some shenanigans, like buying a drug and then raising the price 500% for a drug that had been on the market for a long time. Had to replace the CEO, the chairman, the stock price fell. They don't have a lot of assets to go and promote the drug. They have a very small sales force in comparison to Allergan, the makers of Viberzi. Well, you don't have to take a drug to treat the diarrhea form of irritable bowel syndrome. There is a diet, it's known as the Low Fodmap Diet. Fodmap, F-O-D-M-A-P, stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It was conceived at Monash University in Melbourne, Australia, some number of years ago, and now it's recently gaining popularity here in the United States. Basically, what happens is you consume foods that are high in these FODMAPs, and when they get into the gut, they are turned into gas, and you get cramps, and you can get diarrhea. You want to stay away from what are known as high FODMAP foods. So you want to stay away from asparagus and apples and cow's milk and certain kind of beans. You want to stay away from onions and cabbage and carbonated beverages and broccoli. And instead you want to substitute bananas and zucchinis and certain kind of cheeses and maybe some gluten-free bread and cereal. There's some medicines that are available for treatment of irritable bowel syndrome with diarrhea, like Imodium AD. Works pretty well. They're the tricyclic antidepressants and sometimes the drugs in the relative family of Zoloft and Paxil. Because remember, we said that anxiety and depression is associated somehow with this condition. And we know the drugs work on some of the neurochemicals that the body uses to cause diarrhea. Then we have some Levbid, and we have Bentyl, and we have a drug known as Alosetron or Lotronex. And then we have Xifaxan. Now, Xifaxan, that's the drug that is made by Valeant. It's an antibiotic. It stays inside the intestine. You take it 3 times a day for 14 days. It's thought that in some percentage of the cases of IBS with diarrhea, it's due to an overgrowth of bacteria in the small intestine. Well, you can repeat the drug 2 times if necessary, and it works okay. It's certainly not a home run. Then there's Lotronex, or that Alosetron that I mentioned a moment ago. It was originally approved by the Food and Drug Administration in March of 2000, taken off the market in November of that same year because of an association with certain deaths from ischemic colitis. Then it was returned back to the market in 2002, but only for women, only women with severe IBS with diarrhea who are unresponsive to other kinds of therapy. Now, this is an expensive drug. So whenever you have an expensive drug, the drug companies come up with savings cards, coupons. And if you go and from the doctor, you get one of these copay cards, you'll pay nothing for the first month and then a maximum of $30 for each subsequent month you take the drug. Well, that works well unless you're a cash pay or if you happen to have Medicare, Medicaid, TRICARE, or any other government health care. You can't use the card. The cost of the drug, well, according to the medical letter, when they reviewed it in 2016, it was $960. But just the other day, I looked it up on goodrx.com, and the cash payment for this drug is $40 a day, $1,200 a month, $14,000 a year for a drug that doesn't work very well. So what we have in summary is a horribly expensive pill that's maybe a little bit better than a placebo, but it's never been tested against any other alternative therapy or even a change in your diet. And now we have the drug savings cards that give you a false sense that the drug is cheap. You don't understand when you come at $0 out of pocket or $30 out of pocket that your insurance company is going to have to pay a substantial amount of money for this drug that's highly advertised that doesn't seem to work very well. So in summary, we have a drug that's certainly not a home run, not a double, maybe not even a single. And remember, it takes somewhere between 8 and 14 people to be treated to get one person who responds with a 30% or more reduction in pain. Should this be a first choice? I don't think so. I'm Dr. Ken Landau, and thank you for watching.